Good afternoon, everyone, and thank you for joining us today. I'm Stephanie Nakar, Chief Communications Officer at Agenus, and welcome to our first Stakeholder Webcast of 2026. Today's discussion comes at a meaningful moment for our company, one shaped by important progress across patient access, clinical development, and operational readiness as we enter a pivotal year for Agenus and for the patients we serve. Today's program is designed to reflect the full arc of momentum we are seeing globally. You'll hear perspectives from leaders who are directly shaping this progress.
When we speak about historically resistant cancers, we're talking about very specifically microsatellite stable tumors. And microsatellite stable tumors are in the form of many different types of cancers, and they represent more than 80% of all solid tumors. And importantly, more than approximately 95% of colorectal cancers. I just want to note that, for example, with colorectal cancer, you may have heard in the headlines that there are products such as PD-1s and PD-L1s that have shown some very impressive activity in colorectal cancer patients. But remember, those are less than 5% of the patients. The other 95% of patients targeted by our BOT+BAL are the kinds of cancers that don't respond to these other currently approved products. So at the same time of all of this, the societal burden of colorectal cancer is accelerating. Just last week, many of you may have heard that American Cancer Society and Journal of American Medical Association, JAMA, reported that CRC, unfortunately, is now the leading cause of cancer-related deaths in people under 50. This is not just a medical challenge, it's a societal crisis. And some countries, including France, are recognizing both the urgency and the potential value of immunotherapy and responding to it. As we enter 2026, we're doing so with a greater clarity. With the recent closing of our collaboration transaction, which involved the sale of our facility in Emeryville, as well as our sale of equity at a significant premium to market price, with Zydus Life Sciences, Agenus has strengthened our ability to go about our business. This collaboration secures long-term U.S.-based biologics manufacturing capacity for us because it's the facility that we built, and it's the team that helped build that facility and operationalize some of the wonderful capabilities of that facility. That will allow us to supply clinical and authorized access programs and support future commercialization. Just as importantly, it provides the capital that we need to execute our strategy with a high level of discipline and focus. I don't think the constituency that looks at us understands the full power of our accelerating momentum for patient access. This started in last September with a surprise to the world of France's reimbursed AAC program. This is a program where every French citizen who is eligible for access to BOT+BAL can have access to it, with the French government providing full reimbursement. What began with colorectal cancer in this program has now, in the last few weeks, expanded to include sarcoma and ovarian cancer. These decisions, namely patient access, reflect more than regulatory flexibility. They reflect urgency and a recognition that innovation must reach patients who are in need while the confirmatory trials continue.
Sarcomas are tumours of connective tissue, so the bits that join the body together, so that includes bone, cartilage, muscle, fat, etc. Because of this, because they're tumours of connective tissue, they can occur anywhere in the body. And this makes them very difficult to diagnose. They account for about 1% of adult cancers. And then the third point is that they're very heterogeneous, so there are over 80 different types of sarcoma, each with its own differing biology and clinical behaviour. So those three things together make them incredibly challenging to treat and diagnose. The current treatment paradigm for local disease, so localized tumours, consists of complete surgical resection with or without radiation. The sort of major unmet need remains the treatment of metastatic disease, where we use chemotherapy, older chemotherapy drugs such as doxorubicin, and the first generation checkpoint inhibitor trials have been to a certain extent disappointing for most sarcoma subtypes. There remains a huge unmet need for well-tolerated treatments. My experience with the combination has been very favourable. I've had patients derive durable benefit from this treatment. Many of the other treatments that we have to treat sarcomas can actually result in a response or stabilization of disease. And when we had the trial open in the UK, I was impressed, as I mentioned, with the not only the efficacy and the durability of benefit with the combination, but also the exceptional tolerability. I have very frequent emails, letters from oncologists all over the UK asking about access to BOT and BAL, either through a trial or expanded access programs. And I think for French patients this is fantastic news.
The innovation and the science that Agenus was conducting in immuno-oncology, that really caught my attention. And when I dug into the science, I was really impressed. When I discovered the uniqueness of botensilimab, or BOT for short, as we all know it, it really opened my eyes to a very new domain. I mean, the activities are shown in tumors that normally do not respond to immuno-oncology. At this moment, we have 60 total inquiries from physicians. Outside of France, we have several countries in Europe and also in Latin America providing access to these patients through the named patient program. This increased demand and interest has to be met with resources to make sure that every request for compassionate access is properly assessed, evaluated, and authorized. We need to observe what happens with these patients, collect data, and report it. This program, the Compassionate Access Program, provides what is called the real-world experience. And this data is absolutely invaluable. Our hope and desire is that patients can have prolonged time, but free of disease progression, with a quality of life. There's no point in increasing life if you have to suffer. BOTBAL is a chemotherapy and radiotherapy-free treatment for oncology patients. They're more than Kaplan curves, they're more than confidence intervals, they're more than p-values. These are things that are imponderable in terms of science, but they are very measurable in terms of human outcomes.
So why is BOT and BAL impacting so many tumor types? With traditional oncology, where you're attacking the tumor specifically through targeted therapy or chemotherapy, it's much more specific for a disease. Here, with the immune system, we're actually not targeting the cancer specifically. We're targeting T cells and activation through these very important primal checkpoints, CTLA-4 and PD-1. And botensilimab, which is the next generation CTLA-4, is really the magic of the combination that is driving these T cells to recognize tumors more broadly, even tumors that stay hidden to the immune system historically. So it's not surprising to me that when you have an effective CTLA-4 like botensilimab and a PD-1 that is its companion, and you're activating and expanding these T cells that were not restricted to tumor types. Large phase 1 data, ESMO this year, really speaks to the consistency of the data across these tumor types.
It's remarkable to see this consistency of data across different tumors, across different continents where clinical trials have been conducted, different types of studies, and of course, different stages of disease. And that's what is so revolutionary about BOT+BAL, and it reflects a shift in how we think about cancers and how long have we've considered beyond the reach of immunotherapy, particularly in MSS disease. Patients are asking for better options. Physicians are seeking responsible pathway to treat these patients. As we move through 2026, we remain committed to advancing BOT+BAL with rigor, expanding appropriate access with discipline, and working with regulators, clinicians, and partners to bring meaningful innovation to patients who deserve them.